All right, so we're going to talk about brachytherapy. So, a couple of things about advancing brachytherapy in RayStation. So, we have a module called RayBrachy. So, we know that brachytherapy, cervix, and prostate and boost cases are the important part. The market today consists of two vendors that are varying using brachyvision. They're a mature application, right? They have ARIA integration. However, they're limited by only variant afterloaders, right? Then the next thing that you have is Electa with OnCentra. It's got strong workflows. However, it's a very siloed application, right, that exists by itself. And the development is sort of slow on it. So what are we doing as RaySearch with RayStation? We're fully integrating brachytherapy into our treatment planning system, right? That it's a true vendor-agnostic application that we have the ability to plan for Variant, Electa, and BBIG as the afterloader, and you get the full TPS integration with that. So I think we're like really dedicated to the brachytherapy application, and it's something that's scalable. So by being able to support all the major workflows, so gynae, vaginal cylinders, and doing prostates, and the best part about having it in RayStation is that you get full TPS improvements, right? That it's not a siloed application, it's integrated into RayStation. So any development that happens with RayStation, Brachy takes advantage of that. And you guys are all well aware that RayStation is a rapid developing product, so the roadmap is rapid. So being able to quickly turn around and provide the customers that what things that they need. So you get the ability to do scripting. We have built-in EQD2, right? Two gray equivalents. You get the deformal registration. These are all applications that get constantly updated, and so brachytherapy gets advantage of that as well. And then again, our great development team is backing brachy as well, so those advantages are fantastic with that. Now, when we talk about vendor agnostic, right, by being able to take RayStation, you're breaking out of that freedom, and you're really able to get the afterloader that you need. So on Centra, you're optimizing only Electa afterloaders, right? Brachyvision only optimizing variant afterloaders. With RayBrachy, you get support for all vendors, and the best part about this is that all of the application libraries are available for you. You're not limited by any of those vendors, so you can choose what's best for the patient, what's best for your clinic. And then the clinics aren't limited to those variant and Electa afterloaders, right? That you have the freedom to do that. And RayStation supports flexibility for any of those vendors or third-party applications. So we have vendors who, clinics who may want to do 3D printed applicators. Not a problem. You can bring that into RayStation and make use of that as well. So a really great tool for that. Now, RayStation can give you the basic tools, right? So day-to-day needs of the clinic, being able to do cylinder cases. We can automatically put points, dwell points, like, right, we have scripting, we have automation, we have protocols that you can do that really take advantage of that. Graphical optimization, that's something that many clinics still make use of. So you get like dose painting, something widely used. We have that ability, so you can see on the screenshot here of a cylinder case where all the points are placed there. We also give you the ability to dose scale, rotate coordinate systems, expected tools that are available so you can do the basic standard processes. You're not going to lose any of that functionality by going into RayBrachy. Then, of course, RayStation provides the advanced tools that many clinics want, right? The built-in two gray equivalents, clinical goals, dose distributions, and we have the Ray Optimizer that you can make use of objectives and constraints that you do for external beam planning, right? That is not the case for other vendors because it's built into that. Something that I'm excited about is the multi-criteria optimization, so MCO. That's currently released in our research version, and then we're hoping for a clinical release soon. Python scripting, fully automate your workflow for Brachy, something that is very unique to RayStation. And then we have Monte Carlo dose calculations for BBEG at the moment, but then coming in 2026, that will be available for variant and Electa afterloaders as well. And you can see what we're showing is like the drag and dropping of the isodose line. So we actually do it slightly different, where the sphere is actually taking control of all the different dwell points that are in that. We're not just scaling the isodose lines, but we're actually taking control of that. So you can change the size of that sphere to take control of the different dwell points that are there. It gives the planner a lot more control over just sliding isodose lines. So automation, again, one of the key features of RayStation, right? And so we're solving that 45-minute planning problem, right? That the current infrastructure workflow takes about 45 to 60 minutes, often by two staffs working in parallel. What we currently have under development is like we're doing the deep learning segmentation for pelvis with the applicators. We have auto applicator alignment with CT and MR, and then auto needle reconstruction. So what we're talking about is bringing that 45 minutes down to 15 minutes per case with a single operator. So great to bring those standardizations into the work here. Robust optimization. That's one thing that like RayStation sort of innovated with protons, and it's in photons as well. But you can apply it to Brachy. So we have a great talk on that. That was a innovation with Vienna and doing a collaboration with that. So they made use of some of the functionality that's existed in RayStation for a very long time, right? Organ motion simulation, creating 54 simulated scenarios for plans. And what that does is the quantitative robustness so that you can make your robust application. So you know that for Brachy, the patient is in a very uncomfortable position. So to be able to have those plans done very quickly and using robustness to do that, that just creates a very nice patient experience and user experience as well. So just kind of giving you some competitive analysis, right? On the left-hand side, we're talking about all the different features that you have. So the afterloader, the model, and the optimization, talking about external beam and brachytherapy. So I'm going to break this down a little bit, right? So you have Oncentra, which only does the Electra afterloaders and brachyvision with the variant afterloaders. RayBrachy breaks that out of that, and you get freedom to have that vendor-agnostic ability and be able to choose what you need to do. Then in the model base, like we have Oncentra who does collapse cone and Acuros with brachyvision. We have Monte Carlo with RayBrachy, right? Optimization, both of the other vendors are doing graphical based. We are the only one that has the Ray Optimizer. As I talked about, you can make use of like the clinical goals, objectives, and constraints that are in RayStation, and then a future release of getting Monte Carlo, multi-criteria optimization there. External beam and brachy, this is a big part of it, right? Many patients get external beam along with brachytherapy. So RayStation is the only one that can provide you in one application to be able to give you the external beam along with the brachydose. Then the two gray equivalents, Oncentra and brachyvision, they make you do it manually, or they make you do it that with an Excel spreadsheet. That we have that built in natively into the application. Automation, you know, semi-automatic, manual processes. RayStation, you have access to deep learning segmentation. That's part of the application itself, and then Python scripting, of course, that's part of like base with RayStation. And then the UI, like I talked about, mature products. However, they're limited by being siloed, right? They're not like integrated into the TPS like we are. So what we think with the RayBrachy, we're a modern application, and that's unified. That gives you all of the ability to have the advanced tools that a GPS does. So a couple of the things, it's like the seamless integration. I want to highlight that right, like combining the external beam with brachytherapy. So same contouring, optimization, reporting that you get with the TPS. That two-gray conversion and summation is all built into the plan evaluation module. You can get the dose accumulation and some of the roadmaps that you have is the deformable registration and then using inverse planning on EQD2. Those are the roadmaps for that. So what do we do next? We've been talking about it. So version 2025 was submitted to the FDA for 510 clearance. We believe that's our first complete brachy package that you should have no limitation in switching over to it because we've given you all the tools to make RayStation work. So clinics already have started licensing it and adopting RayBrachy. So I would say the next step is come on by and get a demo here at ASTRO and see some of the workflows and explore some of the automation and scripting. Thank you.
Thank you. Thank you, Makim. I really like to see like so many green marks in one of the slides. We can come back to that slide. And it's
Yeah,
not because I care about that side. It's whatever. But it's like seeing here like all of these green lights.
yeah,
It's
that was
nice.
purposely done.
Yes. It makes it like it's comprehensive, you know?
That's I think we finally feel like that, and that's where when I said there's current users that have adopted that is because they see the results of the work that the development team has done.
And it also comes back to the very first talk that we had for in our RaySearch webinars, and that was about automation. So you mentioned from 45 minutes down to 15.
Yes. Yeah.
That's huge.
That is huge. Yeah, and I think for as I mentioned, the issue with brachy planning is that the patients are in a very uncomfortable position. So we want to be able to treat them, get them out of the door. So having that turnaround of planning is gold. Yeah.
Yes. And I mean, so neither scripting or deep learning segmentation was created for brachytherapy specifically, right?
Yes, and I'm glad you brought that up because having brachy in the TPS with RayStation, you get take advantage of all the development that's happening around treatment planning, right? So the deep learning segmentation and then the two gray equivalents that you get. So front end and back end of all the improvements, and then you have RayBrachy in the middle that's taking advantage of that.
Exactly. And anything else that will be developed and integrated into our software will also be available for brachy planning
Exactly.
as well.
Yeah, and that's the advantage of not being siloed, right? That having that unified application there. So yeah.
No, that's great. You also mentioned something about EQD evaluation, right?
Yes. Yeah.
Yes.
Yeah.
Hmm.
So one of the big things that's needed for brachy is to be able to sum the external beam along with like the boost, which it might be brachy. So we do that native to the application.
Yes. Great. Well, we will talk more about that in the next talk. I know that for sure. But for now, thank you, Makim. Thank you for
My
sharing your
pleasure.
knowledge. Thank you for. I learned a lot more about brachytherapy myself. So thank you for that. Yes.
All right.